leukemias, we are finding the subleukemias, or we are getting the stage of leukemias. So bone marrow is also very important in the microbiological culture for pyrexia of unknown origin, or specific infections like miliary tuberculosis or leishmaniasis, especially visceral leishmaniasis that is taken from the bone marrow, and malaria Plasmodium vivax, a parasite that cause malaria, and it accumulates in the bone marrow. So it's very important for the diagnosis of certain parasite by getting a bone marrow aspirate or biopsy, and evaluation of iron stores, we need bone marrow, and investigation of lipid glycogen, both are called storage disease. So it's very important for the diagnosis to have a bone marrow biopsy or bone marrow aspiration. It's very helpful in the diagnosis of unexplained or unknown causes or unknown etiology. That may be anemia, that might be leukemia, or that might be microbiological, or that may be parasites. So this is an important or a very helpful diagnostic tool in the field of hematopathology. So moving toward the bone marrow aspiration, now we have site of bone marrow aspirate, and up to here we conclude that the bone marrow can be obtained by two different methods. The first method is known as bone marrow aspirate, and the other method is called bone marrow biopsy, and these are the two procedures in which one we take only a liquid form, and the other one we are taking a piece of marrow. And now from where we can obtain these aspirate or biopsy, so we can divide it into two phases. The first one is site for bone marrow aspirate, and usually sites for bone marrow aspirates are sternum, posterior superior iliac spine, iliac crest, anterior superior iliac spine, spinous process of lumbar vertebrae, and in infants, upper end of the tibia is the ideal site for marrow aspirates, where in the bone marrow biopsy, the sites for bone marrow biopsy, that is trifine biopsy, we can take from posterior superior iliac spine. This is most commonly used site for the trifine biopsy, and anterior superior iliac spine, and the spinous process of vertebra. So these are the sites from where we can take aspirate or bone marrow trifine biopsies. So selection of site for bone marrow aspiration depends upon the age of the patient, physique of the patient, and expected distribution of disease process. And now we have the first site for the aspirate, and it's called posterior superior iliac spine crest. So this is the most suited site in adults and children over 2 years of age. It has the ease of puncturing multiple sites in one go, as well as sampling large volume of bone marrow. It is safe, and as the patient cannot see it, it causes less apprehension to the patient. Bone marrow trephine biopsy can also be performed from the same site while the same skin puncture. We can take both at one time. The other side, that is sternum, and the sternum is used in obese but in adult patient. It is punctured opposite the second or third intercostal space, slightly to one side of the midline. The total thickness of the sternum is about 1.5 centimeter. Therefore, it is necessary that a guard be applied to the needle so that it should not penetrate more than 0.5 centimeter of the bone. Is we are taking bone marrow aspirate or biopsy from posterior superior iliac spine crest. Similarly, we are taking aspirate from anterior superior iliac spine as well. It's painful. It's more painful while taking aspirate from here, and this side may be used in obese patient, but is not very convenient. And there are three drawbacks. The first one is it is very painful. Skin being richly supplied with sensory nerve. Secondly, its overlying cartilage is very thick, and the third is more acute and contain less marrow, particularly in elderly patient. So if we are taking sample from posterior superior iliac spine or from sternum, that are very helpful than anterior superior iliac spine. So tibia is also the choice for respiration. It's also the site of respiration. And in case of children less than 2 years of age, intermedial surface of tibia, that is slightly below the tibial tuberosity, is the best site for the aspiration, or it's the best site for the choice. uh, we can also get inspiration from other places, like occasional inspiration may be directly performed from a lesion visible in X-ray, for example, lytic lesion in ribs, and also in skull bone. So the first choice for the aspiration is posterior superior iliac spine. Then we have sternum. We can also get aspiration from spinous process of vertebrae. The spinous process can also be selected for bone marrow aspiration. However, uh, it is necessary that these should be palpable, and this is not the site for choice. If we have posterior superior iliac spine, we have sternum, we have tibia. These are the best site for the aspiration. So different types of needle are used for the bone marrow examination, and we are taking Salah needle and Klima needle as best choice for the aspiration. Here we have two types of needle. One is Klima needle, and this one is Salah needle. Here in Salah needle, it has an adjustable guard, it has a needle, it has a stellate, where we So up to here we can summarize the whole lecture that first we know about the bone marrow. So bone marrow is a spongy connective tissue, and it's present in the hollow cavities of the bone, and that is known as bone marrow. Bone marrow can be divided into two different parts. There is yellow marrow and red marrow, where we are focused on the red marrow during aspiration or during biopsy procedure, or we are looking over whole bone marrow for the procedure, because sometimes we do not get aspirates, or do not get aspirates, like we only take dry tape, and that condition all the marrow is fibrous. There are two different procedures. One is bone marrow aspiration procedure, and the other one is refined biopsy procedure. We will discuss in the incoming lecture, inshallah. And then the most important, that is examination of the bone marrow smear. What we are looking actually in that, we are looking for cellularity, or we're looking for the immaturity, or we are looking for the exact morphology of the cell, or we are looking for the ME ratio, etc. So we will discuss inshallah in the coming lecture a bone marrow spiral procedure and refined biopsy procedure. What is the best, what is the exact procedure of these refined and aspiration, and then we will discuss about the normal morphology of the bone marrow, and then what we will get in the disturbed conditions, like in sideroblastic anemia, or like anemia of chronic disorder, or like in leukemia. So we will discuss it one by one. So thank you very much for listening, and don't forget to listen the video, a bone marrow structure.